Welcome to today's webinar, Leading the Way, Supporting Veterans with TBI and PTSD During Their Reintegration into the Community. I am Carla Giovanniello, Brain Injury Training and Services Project Director here at the Association. Thank you for joining us. Before we begin, a few housekeeping details. Because of limited time, we ask that you please hold your questions until the end of the presentation. During the Q&A session, questions can be submitted via the question text box. The text box option should be visible to you on the GoToWebinar toolbar on your desktop. If you are having trouble viewing this option, please contact Citrix Tech Support at 1-800-263-6317. Again, that number is 1-800-263-6317. This number should also be visible on your toolbar. Our speaker will do his best to answer questions in the order that they are received. Any questions he is unable to address may be submitted via email to the Association. As always, we will be recording this webinar session and plan to post it along with the presentation slides to our website, www.bianys.org. Information about contacting the Association and viewing the webinar will be provided in a follow-up email after the presentation has ended. My contact information will also be included in those follow-up messages, so feel free to look for that and contact me directly. Before I turn over the microphone to Tom, let us begin with a quick poll to see who is in our audience today. I'm launching the poll now. Please take a moment to answer the question. I'll give you about 5 more seconds to answer. All right, I'm going to close the poll and share the results. Okay, it looks like we have a lot of individuals in the audience who are either a healthcare professional or a caseworker, and it looks like the most of you are all affiliated with a brain injury program or organization. So I am seeing a lot of variety. I always love to see that, and I just want to take a moment to thank everyone again for participating, and thank you all for sharing the word about our webinars. It is with sincere pleasure now that I introduce our presenter for today, Thomas Tartaglia. Tom is a program manager for the Warrior Salute program in Webster, New York. He helps facilitate partnerships to support transitioning veterans who are dealing with the challenges of both TBI and PTSD. Tom, good afternoon. How are you?
Good afternoon. Thank you for having me, Carla. So today we're going to discuss the Warrior Salute program. And we're going to go into some pretty in-depth discussions, and I plan on having a lot of Q&A at the end because it helps me grow as a program manager as well and really find out who's out there in the crowd and what innovative techniques you guys use for veterans with traumatic brain injury and how you assist and help them filling in the gaps that are present in today's society. My program is comprised of highly skilled and dedicated professionals who assist service members to develop skills for their well-being and growth so that they may transition back into the mainstream of their communities. SALUTE is an acronym, and it stands for Support, Assess, Listen, Understand, Transition, and Empower. We need to assist all service members in the aspect of his or her life, and we do that by supporting them in a wide variety of ways. We assess them to determine the needs of each service member. We listen to them and ensure that each service member has the opportunity to share his or her feelings and requests. We understand to synthesize specific psychological, social, and vocational needs and goals. We transition them. We plan with them and the individual on how to get them back into community life and reintegrated to become a positive member of society, and then we empower them and provide each service member with the tools to live independently and productively in their community and make informed choices and decisions. Today we have some goals of the presentation. I'd like to highlight our clinical program and illustrate the holistic approach that we take and describe some of the assessment and treatment tools that we utilize for both traumatic brain injury and post-traumatic stress disorder. So we do have just a quick poll question here, and it's pretty serious, and I like to start out with this question because it really delves into the seriousness of veterans living every day in our community. So today we're going to ask, go ahead, Carla.
Oh, I'm sorry. I was just going to get ready to launch. You can finish. I apologize.
Okay. No, we're going to ask how many veterans commit suicide daily?
Okay, I'm going to launch the poll question now. Please take a moment to answer. Give you a few more seconds. All right, I'm closing the poll and sharing the results now. It looks like 60%, the majority, answered 22, and 22% answered 12. That was the second most popular answer.
Right. And actually, it is a 22. There's almost a veteran an hour every day committing suicide. It's an extremely important aspect, and it's something that we take very seriously in our community. And working with our veterans, we have a lot of safeties in place for them. We've seen a lot of progress with the Veteran Administration coming up with a suicide prevention hotline, as well as other agencies coming out with a give an hour, have an hour, and really just taking a therapeutic approach to helping these veterans transition and deal with some of their everyday issues. Thank you. So the severity of PTSD and TBI, and this is going to support that piece that we just went over. Data released by the Veterans Administration in February 2013 puts the number of U.S. military vets lost every day to suicide at a staggering 22 veterans. As we learn more about what's affecting the men and women coming home from Iraq and Afghanistan, it's becoming very clear that both PTSD and TBI, through explosions and other concussive events, may be strongly linked to vets taking their own lives. This week, researchers at the National Center for Veteran Studies in Salt Lake City reported on a link they found between the number of TBIs and depression and thoughts of suicide. So again, touching base on how serious of an event this is and how severe of an issue it is. It changes the landscape of our community and how we help veterans. So I'd like to introduce some of our professionals that work with us. This is an abbreviated list. We partner up with dozens of local organizations as well, but we do have a fair amount of medical professionals that work directly with our program. We have Dr. Scott Tripler, our medical director, Dr. Kimberly Kalish, our clinical director, Sarah Brassey, who is our clinical licensed art therapist. We have Greg, who is our case manager, a mental health counselor, licensed mental health counselor in Carrie Medley, Debbie Smith, our registered nurse, Laura, who is our vocational specialist, Rebecca, our speech and language pathologist, Joe, who is our music therapist, Bethany and Diana, who are physical therapist and dietitian, Robert is in our independent living skills training, and Eric, who is our coordinator for veterans education. We have a medical advisory board and a quality assurance team that both oversees the program as well. So we've partnered up with agencies outside and invited doctors and other medical professionals to be a part of the medical advisory board, as well as an internal quality assurance team to ensure that we have a very in-depth and quality program. So you can see by the listing of our professionals how in-depth and how varied our program truly is. Here's a picture of a group of our veterans in front of the new courthouse. We have a 14-bedroom residential facility that the veterans live in. They do travel into our day program from 9 a.m. till 3 p.m. And after 3 p.m. they do go back to the house. We try not to do any therapeutic work at the house. We like that to be their sanctuary, where they can get away from all the hard work that they've done throughout the day and really focus on just transitioning and community living. So we found that this house really brings all the guys together and girls together at the end of the day They're able to kind of discuss with each other how their day went. Typically, they all sit down and eat dinner together and come together almost as a small family. So we're going to get moving and discuss the assessment process and how we work with each referral. They do come into our program for the initial day and go through an 8-hour assessment process. It can be done in person. We have been able to support via Skype or telemed. Our individual veterans participate in a barrage of diagnostic exams for both PTSD and TBI. We'll go over those in a little bit. And each clinician assesses on their specific discipline and assure the rest of the clinical team that the veteran is an appropriate fit for the program. So we have typically hundreds of veterans that apply for our program every year. We're very small and we're privately funded, so we can only typically help in between 40 and 60 veterans throughout our process. It costs about $20,000 for an individual veteran to come through our program. Like I said, it's privately funded, and we foot that bill. The veteran doesn't have to pay anything to be in our program. So we need to make sure that the veteran, one, is physically and medically appropriate for our program, but two, is that they're willing and able to transition, and they're not just looking for another step in the system and trying to kind of milk off the system. So we make sure all of our veterans are extremely goal-oriented. So to discuss the clinical program, it's a 14-bedroom transitional treatment program designed to promote adjustment from an inpatient setting to independence. We provide comprehensive therapy, vocational assistance, and case management to active duty service members and veterans experiencing changes in related and military activity. And we specialize in the treatment of TBI and PTSD in Operation Enduring Freedom, Iraqi Freedom, and Operation New Dawn veterans, and treat veterans of other conflicts as well. We do focus on recent onset PTSD and TBI. So we really like to dial into the OEF, OAF, OND veterans. We feel that typically they're more treatment ready than some of the other veterans that we've worked with, but we're not prejudiced on specific conflicts. We've had Gulf War veterans in the program at a couple different times throughout as well. So we also provide sobriety support. We understood that was one of the most important pieces. Veterans with TBI and PTSD often, probably about 90%, come in with a dual diagnosis. Discussing the piece where active duty service members can come into our program, we do have a treatment program where they can come in and then essentially return to duty. We're having some challenges with the U.S. government justifying a veteran leaving our program and going to a non-VA facility because we are not affiliated with the Veteran Administration. However, we're looking at bypassing some of that and really helping to assist veterans return to duty as quickly and safely as possible. We utilize 3 distinct tracks. So I'd like to go over another just quick question, and Carla can launch it. How many veterans will be returning home in the next 5 years?
All right, I'm going to launch the poll now. Please take a moment to answer the question. I'll give you a few more seconds. All right, I'm closing the poll and sharing the results. It looks like the majority answered 350,000, 51%, and then the next most popular answer was 26% answered 250,000.
Okay, and we're actually looking at even more than that. It's an astonishing number that we're looking at. We're looking at 1 million veterans returning home in the next 5 years from duty and transitioning back to civilian life. We also have some pretty real decisions to step forward with, and that's going to lead us right into our next question here. What percentage of those veterans are affected by TBI and PTSD?
All right, I'm going to launch that question now. Please take a moment to answer. Give you a few more seconds. All right, I'm going to close the poll and share the results. So it looks like the majority answered 25%, at 84% who answered that for that answer, and then 14% answered 15% of them will be affected.
Yeah, it is 25%, and it's an astonishing number that we're going to have about 250,000 veterans returning with PTSD and or traumatic brain injury, most of which are probably going to be undiagnosed because they're going to choose not to go through the VA process or go through a private practitioner and essentially take things on themselves. A lot of the traumatic brain injuries that occur, the veterans are pushing forward throughout the combat zone and shake it off and don't take a medevac or return, and do return directly to duty. So we see that the undiagnosed traumatic brain injuries typically start to really affect the veteran up to 2 years after they return home. A lot of those symptoms really come forward and they start struggling with them, and it's typically after a divorce or typically after you know, the bottom falls out of their life that they start realizing that they can't handle all of the issues themselves. And then we start seeing them go through the VA process, and sometimes the VA does miss the diagnosis as well. Sometimes the veteran doesn't necessarily remember what happens overseas and throughout time. Even being shaken or rattled up in a vehicle accident or a vehicle rollover, a lot of the veterans feel that a traumatic brain injury has to occur directly from a concussive blast or something along those lines. But we find that you know, one of the lesser chances of that happening. With the landscape of warfare today, we see a lot of the veterans are in vehicle rollovers and vehicle accidents or just simply getting shaken up inside of a tank or something along those lines. And a lot of those repetitive concussive injuries, you start to see the symptoms of a mild traumatic brain injury come out, or a specific, you know, a major traumatic brain injury. So our holistic model, by utilizing our individualized approach, Warrior Salute is able to set up a specific program plan for the individual and really set them up for success. We do this by utilizing a strict assessment process, which we'll discuss in just a minute. And each tool utilized throughout the assessment is utilized or used by an experienced clinician, psychologist, speech-language pathologist, independent living skills trainer, et cetera, et cetera. We do set each of our veterans up with an individualized plan. We understand that every veteran is different, every injury is different, and we deal with that in many different ways. But the most important to us is that the veteran knows they have their individual goals, and we're going to help them accomplish those goals any way possible. So our three distinct tracks that we have through our program. Track 1 is a simple Warrior Salute program, very intensive treatment for PTSD and TBI. It ranges 3 months to 1 year. It has a very strong clinical focus. Most of our veterans graduate from this track. Most of the veterans that do come into our program graduate usually right around the 6-month time frame. We have had veterans come in, do extremely well, work very, very hard, and graduate in 3 months. And we've had veterans that have had some relapses and setbacks, and they've bumped, you know, to graduating in about 12 months. We've also had some veterans that have come in that we knew needed some more intense services, some physical therapy, some other things like that, and they've spent some more time with us. The second track, Track 2, is very just based on emergency support. We take a very intensive case management approach with these veterans. It's only a 30 to 60-day program, a strong vocational backbone to this program, as well as residential placement focus. It is very, very case management driven. It's for the veterans that are homeless or that are coming in and just had a crisis situation. We've had veterans that they've had their house burned down, or they're going through a divorce and they're living out of their car. So we're able to kind of take those veterans and put them under our house and our program, find them work, get some food in their stomachs, put a roof over their head for a couple months until we can get them back on their feet. And that program, we've seen a major need for that recently. Probably within the last 14 months, we've rolled out probably 5 or 6 of our veterans through that program. We were essentially denying veterans that needed that and referring them to other facilities around Rochester locally. However, we found that we can truly help these guys and girls a lot more effectively than some of these other agencies can. By the time we referred them, it was a 1 to 2 week wait. So we're able to bring them in and really help them with that emergency support and transition them accordingly. And oftentimes a veteran will come into Track 2 and realize that what they really need is Track 1 and essentially transition to our Track 1 program as well. So Track 3, when a veteran graduates from our program, they don't necessarily just get up and leave. We have our graduate support program. It is a continued support information and referral program. We help them transition, and then after they transition, we maintain contact with them. I typically work with a case manager as well as some of the other transitionary support team members, and we usually make contact about once a week with graduated veterans. We help them with a wide variety of referrals. We make sure that they're going to their meetings or they're going to their doctor's appointments at the VA, or that everything is safe and sound. We also continue to work with them vocationally. After they have a job, we work on promotions, we work on resume building, and continue building on the basis and some of the backbone that we got them into the program under. So we really help them continually develop after they graduate through our program. Some of the admission criteria for our program. They do need a diagnosis of PTSD or TBI related to military activity. It doesn't have to be both. It could be one or the other. We see often the veterans with a TBI almost all the time have PTSD. They don't need to be diagnosed through the VA. We can do our diagnosing right on site. A lot of the veterans may have an issue with the Veteran Administration, or they have a distrust for the government, so we're able to kind of come in and fill that gap. We do require at least 60 days sobriety, so we can't have veterans coming in that are using or drinking currently, and that's for the safety of all of the other veterans in our program. And we need to ensure that they're safe and not considered a high risk or danger to self or others. Medically independent, like I mentioned, we do have a 14-bedroom residential facility. That residential facility is staffed 24/7. However, it is staffed with support specialists. There's not medical professionals that are there. We do have our support specialists trained on a wide variety of issues and how to see some of the suicidal ideations or homicidal ideations and what to do from there. We do also have an on-call system. However, we're not an inpatient setting. We don't have the financial viability to do that. So we need to ensure that our veterans are medically independent when they come into our program. Treatment ready and goal oriented, I did mention that briefly earlier. We need to ensure that all of our veterans are motivated and ready to essentially get back into society and continue making a positive impact. And then obviously all of our informed consent and warrior salute practices and everything along those lines. So to discuss a little bit more about our emergency support program, we do have 4 bedrooms for veterans in need of emergency housing. We do go through the same assessment process. However, their goals must be more geared towards vocational and education. I want to get back on my feet and get moving as quickly as possible. Graduate support, all of our graduates can continue to receive ongoing support as needed. We do develop a new individualized program plan for them. The services are determined by the veteran and the treatment team. The veteran does take the lead on that, however. Even in some of the past cases of our veterans not graduating from the program, we see a lot of them come in with a crisis situation. And unfortunately, a lot of times that situation may take them away from our program as well, whether it's a recent divorce or something along those lines where they have to get up and leave and go back home to square some things away on their end. So even those veterans that may not necessarily graduate, we still ensure that they're transitioning safely and that they do have the proper plan set in place and that we can support them as well. Okay, our clinical assessment process. We do have a short list here of a couple different clinical assessments that we utilize. Like I mentioned earlier, our staff psychologist, Dr. Kimberly Kalish, does typically take lead on the assessment process. And then our supportive clinicians, our speech and language pathologist, our substance abuse counselor, our case manager, follows up with some of their individual assessments as well. So for mental health, our biopsychosocial assessment and interviews typically done by Dr. Kalish. our assessment for traumatic brain injury, we utilize the mini-cog, the Cognostat, and then a wide variety of others as well. Those are done by both Dr. Kalish and Becky Stewart, our speech and language pathologist. Depression assessment, alcohol use assessment, we use CAGE. Anxiety and PTSD, we use PCL, CAPS, and the GAD-7. And then we also go through and utilize an anger questionnaire. And to continue, our speech and language assessment and nursing assessment as well. And some of the more supportive therapies, vocational support, we'll go through and do an in-depth assessment and ensure that their goals are oriented towards employment or school again. So for efficacy of our tools, when investigating tools for an assessment, it is required that the tools have to supply specific items. They must be proven effective, lead to measurable outcomes, and provide specific data points to measure progress against. And each tool is utilized and researched in depth by our staff psychologist, our clinical coordinator, and more specifically the practitioner utilizing the tool. Like I mentioned before, we are privately funded, so we need to ensure that all of our funders understand the progress that our veterans make. The graduates are the best testament to our program, but also we need to support with specific data points to apply for grants, and they must be proven effective so that we can utilize them. Our diagnostic tools for TBI, the assessment of communication skills in adults, we utilize that. That assists in measuring, recording the functional communication of adults with speech and language and cognitive communication disorders. It assesses social communication, communication of basic needs, reading, writing, and number concepts, and daily planning. Our independent living skills trainer takes the results of a lot of the diagnostic tools and works hand in hand with our with our speech pathologist, and really helps accomplish the goals that the veterans set. We also use the Western Aphasia Battery, and that assesses the linguistic skills most frequently affected by aphasia, in addition to key non-linguistic skills, and provides differential diagnosis information. The Brief A Behavioral Rating Inventory for executive functioning adults, that assesses executive functioning, memory, planning, organizing, etc. And then we assess communication activities in 7 areas: reading, writing, using numbers, social interaction, divergent communication, contextual communication, nonverbal comms, sequential relationships, and humor, metaphor, absurdity, by utilizing the CADL-2, which is the communication activities of daily living. So our core therapies that we utilize throughout our program. Like I mentioned, we're very, very heavy on our psychotherapy. To support that, we utilize prolonged exposure therapy, and that's done by our clinical coordinator, Carrie Medley, as well as Dr. Kalish. We do one-on-one substance abuse work with our case manager, as well as our CASAC. Independent living skills training. We utilize a seeking safety group, which is for dual diagnosis. It helps work with veterans that have been diagnosed with PTSD, TBI, as well as substance abuse issues. We utilize an anger management group, which we've seen a lot of progress with. We've had a lot of veterans coming into our program with some pretty major TBIs, and a lot of them, when they wrap up our program and do graduate, they mention that the anger management group was one of the most helpful groups for them. We do a graduate support form. After they do graduate, they're able to rate us on how our services are, and we typically see the anger management group one of the most popular and highly rated groups. Sleep hygiene group, and a ACT group as well, which is acceptance and commitment therapy. Sleep hygiene is obviously very important. A lot of the veterans make some pretty poor decisions on sleeping. We see a lot of caffeine intake later in the day. We really like to focus on relaxation techniques. We try to avoid our veterans being over-medicated, which we've seen in the past, and we like to get them back to a simple medication program. We've seen veterans come in with as many as 30 to 40 medications throughout their time in our program. We really like to get them down to as few as possible and have them utilize a holistic approach towards that. Speech and language pathology, our traumatic brain injury specialist, Becky Stewart, works with them and does a lot of work with memory and cognition and word retrieval. To support that, we have a lot of electronic supportive devices. We work with our independent living skills trainer. They do utilize the Brain Train and some other electronic devices as well. I believe Luminosity is another one that all of our veterans are doing on their spare time as well. Some of the more supportive holistic therapies that we offer, we have nursing and oversight education. Our medication management is done through our registered nurse, speech and language path, meditation therapy, vocational counseling, the Brain Train that I mentioned earlier. We have in the past offered a grief group. We're currently not offering that anymore. We typically roll that into smaller individual sessions. We have outsourced our pain management group to the VA, and the veterans that are interested in that group do typically push out towards there. We also offer an exercise group. We have a certified personal trainer that comes in and works with them. We've seen that with dopamine levels and serotonin increase, and really fight through some of those depressive states that they're in. We have a recreational therapist that comes in twice monthly and gets the guys at outings, really brings them out to public events and helps them deal with some of their hypervigilance. And when the veterans are together in a larger group, it really helps them. We also support with off-site Narcotics Anonymous and Alcoholics Anonymous meetings. Our dietitian does some of the nutritional work as well. We do have a relaxation therapist and an art therapist that helps work with them. We have had a yoga instructor come in the past and work on some of the movement work. Our music therapist, Joe Kostecki, does both individual and group work with them. He's an incredible guy. And we find that music therapy and pet therapy or equine therapy are two of our more important supportive holistic therapies. We see a lot of the veterans that are struggling to express themselves coming through the psychotherapy or the one-on-one or even some of the group works. They're able to sit down with an art therapist or music therapist or even the equine therapist at the local horse farm that we work with, and they're able to express themselves that way. And they really feel more comfortable with whether it's riding a horse and discussing some of the issues or expressing their concerns through music. We've really seen some great progress, and some of the veterans that weren't able to have breakthroughs in some of the individual sessions utilize the music and equine therapy and art therapy as well to push through that barricade. We have had some supportive marital therapy as well. We do work with the spouses and families of the veterans, as you see there with family therapy, and then intense case management and some peer-to-peer work as well. So after our veterans do graduate our program, they are allowed to come back in and work with some of the other veterans and discuss some of the trials and tribulations that they went through, and we've seen that also has a large impact. It gives the veteran that's in the program still something to look forward to, and a lot of our veterans are local, so they do want to give back to the program that gave them so much. Our counseling program supports veterans and their families following a military-related TBI or trauma through individual and group therapy, as well as individualized activities outside of the therapy session. We assist veterans to address their underlying causes and symptomologies, as well as cope with symptoms and learn new skills to improve their quality of life. Improvement is ultimately experienced in mood, functioning level, relationships, and career or educational areas. We're going to discuss a couple different things now. We're going to go into some pretty in-depth therapeutic approaches and how they affect and how they help our veterans. And this is really going to dial into the holistic approach that we take. Our prolonged exposure therapist is Dr. Kalish as well as Carrie Medley, and they utilize exposure therapy, and it's been shown to be one of the best ways to overcome PTSD. The National Center for PTSD explains it in this way. Exposure therapy is a type of therapy that allows you to decrease the stress about your trauma. This therapy works by helping you approach trauma-related thoughts, feelings, and situations that you have been avoiding due to the distress they cause. Repeated exposure to these thoughts and feelings and situations help reduce the power they have to cause that distress. Exposure therapy includes providing veterans with education, breathing retraining, materials to read, We also assign homework to complete, practicing and facing fears in day-to-day life, and talking about trauma repeatedly throughout imaginal exposure to help veterans emotionally process what has happened. Imaginal exposure is taped, and the veterans listen to tapes in between therapy sessions. Our symptom management or coping skills are key throughout exposure therapy. The veterans learn their tools for relaxation, managing anger and anxiety and panic attacks, improving sleep, and undergo cognitive restructuring. So like I mentioned, they do tape their individual traumas. They listen to them throughout the day. We typically start them off with once or twice inside of the program, and then we push them to start listening to it outside of the program when they're at home. They still have the support structure that they need. We do our in vivo exposures starting out with the assistance of a case manager or myself or one of the other clinicians. We find that veterans with hypervigilance tend not to go to the grocery store or some of the larger events. So we put them in those situations, and we give them those coping skills that they need and help them transition. We have some very, very active areas of Rochester that we like to take them to and help them transition accordingly. So we start them out with the assistance of a clinician or a therapist present, and then we slowly dial that back so that they're doing it on their own. Chemical dependency. Like I mentioned before, we're seeing a lot of our veterans struggling with chemical dependency. The goals for this program are to help each veteran who participates in the program to attain the insight and abilities needed to live a sober life without needing the assistance of drugs or alcohol to deal with the main difficulties they face when returning home from a combat environment. Whether these difficulties be physical pain from the injury, emotional pain related to PTSD, or impediments resulting from a traumatic brain injury, our goal here at Warrior Salute is to first recognize the attachments many of our veterans have to substances regarding their coping methods for these ailments, and then to assist the veterans in breaking these attachments while at the same time creating a new, healthier coping method. It is a well-known concept that many of our veterans do suffer from chemical addiction. This actually makes logical sense, as chemicals do offer quick, temporary, but efficient relief from their symptoms. Unfortunately, this often becomes a problem of its own and then proceeds to destroy not only the life of the veteran, but any person who cares to have a relationship with them. Our primary goal for the veteran is for them to achieve sobriety and, more importantly, to maintain it. What we offer here in our program is the tools and support for them to do so. The veteran is expected to take an autonomous role in their own treatment and dictate their own goals and objectives as they relate to recovery from chemical dependence. These goals will be reevaluated monthly to ensure that the progress is being made and that we can adjust accordingly based on the needs of the individual veteran. The program reserves the right to test the veteran by urine screen for presence or absence of illicit mood-altering chemicals. This includes alcohol, prescription medication not prescribed to the veteran. Our independent living skills services may include assessment, training, and supervision of or assistance to an individual with issues related to self-care, medication management, task completion, communication skills, interpersonal skills, socialization, mobility, community transportation, reduction and elimination of maladaptive behaviors, problem-solving skills, money management, pre-voc skills, and skills to maintain a household. Our ILST services are individually designed to improve the ability of the participant to live as independently as possible with the community. Independent living skills trainers may be provided in the participant's home or in the community. The service is provided on an individual basis. Most of our veterans do receive this service. In one way or another, they usually push back pretty hard, stating that they don't need an independent living skills trainer. However, what we see over time is that there's a lot of gaps in their life that they may haven't had to take care of prior to their life right now, whether they're just getting out of a relationship and their wife or husband was taking care of specific things, or they were in the military for an extended period of time and they don't really have the repertoire of cooking or budgeting or balancing a checkbook. So our ILST plays a very pertinent role in our program. Here you have a picture of the new courthouse. We do have a couple of veterans living there. They do transition out of that house back into community living. However, our independent living skills trainer does work with them and does assist them in cooking meals. And then we have a schedule where our veteran will cook a meal for the other 12 to 14 veterans, and they do rotate, I believe it's for 3 to 4 days at any given time. So, speech and language pathology. Our speech and language therapy in the Warrior Salute program is provided by a licensed SLP. Individualized therapy sessions address the cognitive and communication problems that significantly impair the veteran's ability to live independently with a TBI. The focus of therapy may involve communicative rehabilitation related to disorders in the comprehension of language and/or disorders in the use of language. Individuals may have difficulty understanding what others are communicating or may have difficulty expressing themselves. Speech and language therapy may also focus on improving reading, spelling, and writing skills that have been impacted by the TBI. The veteran with a brain injury may also experience difficulty with social communication or pragmatics such as maintaining a topic in conversation. The SLP is instrumental in assisting a veteran in improving his or her social communication skills. Articulation problems, difficulty with speaking clearly, and swallowing disorders may occur after a TBI due to weakened or uncoordinated muscles necessitating speech intervention. Cognitive communicative difficulties that may be treated by the SLP include attention to task, memory, reasoning, problem solving, and executive functioning, goal setting, planning, self-awareness, and self-evaluation. Case management. Our program assists with veterans referred to the program in gaining access to necessary services and supports appropriate to the needs of the individual. Case management is provided by the qualified case managers and used as a person-centered planning in developing, implementing, and maintaining their individualized program plan. Case managers promote the concepts of choice, individualized services, and support, and participant satisfaction. We do conduct weekly face-to-face meetings with the veteran. We provide advocacy by protecting and upholding their rights. We ensure that the veteran's living environment is safe, maintain the documentation required as part of the veteran's case management record. We do assist with obtaining and maintaining benefits for the veterans as well, completing all required reports, referrals, and documentation to assist the veteran with assessing requested supports and services. We work closely with the clinical team to ensure the veteran's needs are met, and we ensure the veteran satisfaction and all veterans receiving services are provided opportunities to give feedback on the quality of the services they are receiving. Vocational support. Vocational services offered within the Salute program include vocational counseling to identify immediate and long-term career and educational goals, part-time work opportunities to immediately establish positive work habits and/or behaviors, polishing of interviewing skills, the creation or updating of a resume, practicing in how to research and apply for an open job opportunity, utilizing online application systems. We do participate with mock interviews with an area employer to obtain objective feedback and support, and counseling after they're on the job. For individuals interested in pursuing their education post-graduation, after completing the basics above, rather than focusing on obtaining employment, the vocational counselor veteran will research schools with them and training programs to find the best match and complete necessary pre-enrollment paperwork to assist in the transition from Salute to college or vocational training post-program. So we do have a couple on-site job opportunities for the veterans, like I mentioned. We have 3 or 4 piece work positions that the veterans have access to. Here you see Chris, one of our original graduates from the program, doing some press work with one of the machines that we offer. And they are paid a minimum wage stipend when they do come into the program to work right off the bat. Some of the veterans in crisis, this means a lot to because they don't have access to employment. Art therapy is a mental health profession that uses creative processes of art to improve and enhance the physical, mental, and emotional well-being of veterans of all ages. It is based on the belief that creative processes involved in artistic self-expression helps people to resolve conflicts, problems, and develop interpersonal skills, manage behavior, reduce stress, increase self-esteem and self-awareness, and achieve insight. And as I've mentioned before, we see a lot of our veterans that have struggled in the past really reaching out to one-on-one therapies. We start to see that progress throughout there. Here we have one of our veterans that graduated from our program and returned to duty, that of which went back to Afghanistan and utilized some of his art therapy skills and did some murals over there for them. And then we have an outside picture of our 14-bedroom residential facility as well. Relaxation and movement therapy, focused on movement behaviors that emerges in the therapeutic relationship. Expressive, communicative, and adaptive behaviors are all considered for the group and individual treatment. Body movement as the core component of dance simultaneously provides the means of assessment and the mode of intervention for dance and movement therapy. It is practiced in mental health, rehab, medical, educational, and forensic settings, and in nursing homes, daycare centers, disease prevention, health promotion programs, and also in private practice. We also use acupuncture. We started using acupuncture probably about 6 months ago, and we found that it really helps with a lot of our veterans as well. It can reliably, safely decrease pain and inflammation, quiet spasms, boost immunity, dispel migraines, as well as a wide variety of other positive side effects. It has also been shown to cut recovery time from surgery almost in half, and is helpful alongside of many conventional therapies. We also work with our dietitian. They provide nutritional counseling on an as-needed basis for the Salute members. Like I mentioned before, we see a lot of veterans coming in, and they're used to essentially just going to the chow hall for three to four meals a day, and when they get out of service and combined with their PTSD and TBI, they're not used to cooking for themselves, and we see a lot of unhealthy eating habits. So that's when our dietitian steps in and really helps them transition. We also take them to the grocery store and tour for healthier substitutions and really help them dial that piece in. Physical therapy, we do have an on-site physical therapist is concerned with identifying and maximizing the quality of life and movement potential within the spheres of promotion, prevention, diagnosis, treatment, intervention. This encompasses physical, psychological, emotional, and social well-being. Our physical therapist in the past has worked diligently with a lot of our veterans that were injured through gunshot wounds or blasts, or maybe missing limbs, or work with prosthetics. Here we have one of our original graduates, Chris, again working in the pool. Chris, as well as David, one of our other veterans, we weren't seeing the progress that we wanted to in his or their physical therapies. David spent about a year in our program and had about 23 surgeries on each leg when he returned from Afghanistan. And we really worked with him diligently with an on-site physical therapist as well as an off-site physical therapist. And we didn't see the progress we wanted to until we got him into our pool. We do have a pool that's wheelchair accessible. It does have a lift on it as well. And once we started putting the weights in their hands and saw some of that resistant training, we were able to start watching David and Chris be able to grow and progress a lot quicker than they were. David was actually, when he came into the program, he wasn't able to stand on his legs for more than an hour at a time before needing 15 minutes to sit down and take the pressure off so the pain would go away. By the time David graduated our program a year later, he was working 8-hour shifts at a local factory. So he's done, he's had some incredible progression since he's been in our program. Equine assisted therapy. Horseback riding is a progressive form of therapy for individuals with mental or physical challenges. The physical activities involved in horseback riding prove to be an effective tool for improving muscle stimulation, strength, coordination, flexibility, posture, and balance. While providing these physical benefits, equestrian activities also increase communication, social, and organizational skills to help enhance self-confidence, self-discipline, cooperation, teamwork, and independence. Again, we've seen a lot of our veterans coming out of the community, and some of the ones that are mandated to be in our program really struggle with one-on-one. But once they go through the equine-assisted therapy, we really start seeing them progress a little bit more. There's one of our graduates, Brad, on his horse. And again, Brad did an incredible job. Occupational therapy is a discipline that aims to promote health by allowing people to perform meaningful and purposeful activities. ROT works hand in hand with our physical therapist, and they work with the veterans who suffer from the mental and physical, developmentally, emotional disabling condition by utilizing the treatments that develop, recover, or maintain activities of daily living. The therapist helps the veteran not only improve their basic motor functions and reasoning abilities, but also compensate for permanent loss of function. The goal of OT is to help veterans have an independent, productive, and satisfying life. our music therapist, who, like I mentioned before, has a very prominent role in our program. It's the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. Music therapy interventions can be designed to promote wellness, manage stress, alleviate pain, express feelings, enhance memory, and improve communication, promote physical rehab. Other goal areas may include improving sustained, selective, divided, and alternating attention abilities. This is done through our MACT, which is Musical Attention Control Training. Developing executive functioning skills, including organization, problem-solving, decision-making, reason, and comprehension through musical executive functions training. We improve stress management, mood regulation, relationships, and communication through music psychotherapy and counseling. These goals would be addressed through group music therapy activities that require participants to exercise these skill areas. Here's one of our, actually one of the veterans that's currently in our program was just working with one of the music therapists that we had a guitar recently donated to us. So here you see him kind of working diligently as well. Nursing. Our nursing services provide to the participants in the SLUIP program ongoing assessment, medical resource, and referral information. We do have a registered nurse that's a member of our SLUIP team. The RN's responsibilities include a wide variety of pieces. Mostly it's just oversight, medication management, and assisting the veterans to become more independent with their medications. Pet therapy. We do have animals that we work with hand in hand. We have had veterans in the past that do have service animals, but we also have pet therapists that do come in. I think on the next slide we'll see a couple pictures of some of our dogs. They do not communicate with words, and so clients afraid of approaching people can comfortably approach with an animal. Additionally, a therapist who brings along a pet is viewed as being less dangerous by the veteran, and so the previously uncommunicative veteran is willing to share more with this professional. Here we have a couple pictures of some of our dogs, and there's Sam, one of our more recent graduates, with his PTSD therapy dog as well. Seeking safety, we mentioned before, it's the dual diagnosis group. It was designed for flexible use and has been conducted in the group and individual format for both men and women of mixed gender using all topics. However, we typically focus on dual diagnosis for PTSD, TBI, as well as substance abuse. Our sleep hygiene group. Warrior Salute veterans may also participate in learning sleep hygiene techniques with group therapy format. Education is provided regarding tips in improving for quality and quantity of sleep. Outside tools are utilized such as exercise, sleep journals. These group settings encourage the opportunities to be supportive to one another. Our anger management group we discussed earlier as well really has a prominent role in our program. So our progress through the program, let's kind of dial through these pretty quickly here. We do start with a quick phone interview to make sure that the veteran is goal ready and treatment orientated. Then we go through our barrage of psychological, vocational, speech, and nursing assessments. They do have a 30-day pre-admission trial period in our program to make sure that they are motivated and on time for therapy every day and ready to work. We do review our independent individualized program plan every 2 weeks, and then 1 month, and then 5 months, and any time additionally as needed. If the veteran wants to adjust their goals, or if we want to adjust their goals or move them forward or backward, we can always call an individualized program plan meeting. Their admission period from 3 to 12 months, they're able to start utilizing some discharge planning. Program analysis, just some percentages of retention rate and success rate. We do have all of our branches served. The only branch that we haven't had served is the U.S. Coast Guard. We typically don't see a lot of Coast Guardsmen with PTSD and TBI that are reaching out. As I mentioned, we help both female veterans and male veterans. I discussed the 3-track system already. We went through the slide, but I did want to just touch base again briefly on the graduate support program. When our veterans do graduate, we do maintain contact with them. Here we see David, who is now, we actually see the caption in there as well, who now speaks nationally on not only behalf of our program, but on behalf of NISH and some of the other programs that he's been through as well. David was the gentleman that I mentioned who was shot once in each leg. His story is nationally known. Typically, when a veteran comes into our program, they're never nearly as outgoing as David was, but David made a large impact on our program, and hopefully we helped him get what he needs to get to transition. He's currently living down in Georgia. We've helped him transition to VA system down there, and he is enrolled in school and does travel nationally to discuss about veteran disabilities and employment opportunities as well. I discussed the pre-admission phase already, and then the admission period. That first phase, they are engaging in all of the therapies. We do monitor their professionalism. They do have a curfew, and then throughout the phase 2 program, their extended curfew, they still have their regular drug screens, and they may graduate from specific therapies or transition to other ones as well. Partnerships. Like I mentioned, our program does rely heavily on our local community that is up in Rochester, New York. We wouldn't be able to have our program as proficient as it is without local partnerships. We understand we can't do everything, so we partner with dozens of agencies that offer services that we can't provide specifically. They can include, but aren't limited to, working with the Veteran Outreach Center for service connection claims, legal services with Volunteer Legal Services of Rochester, housing assistance through the STEPS program, which is a New York State-based program. The national, we really reach out nationally and work with the National Resource Director, or Directory as well. The Equine Center takes care of all of our equine assisted therapy. We work with local VAs for a wide variety of things that we mentioned earlier, prosthetic fittings. And then we also work with Veterans Corps nationwide. So we do have veterans that are mandated to be in our program as well. We do some peer-to-peer mentoring with a local agency called Compeer. And then we work probably with about 100 local agencies for job placement, one of which is One Team, One Fight. Their website's on there. We work with them locally. They essentially get us to assist us to bypass the human resources process, which we find is extremely restrictive towards veterans with disabilities. And unfortunately, that's how it is, but we work with that organization and local CEOs to help bypass that. And nationally, we work with the National Resource Directory to help some of our veterans that may not be local. Here we have another picture of some of our partnerships. This is with actually Monroe Community College, and they're presenting their Veterans Club from the local college. Came out and did some volunteer work with us and worked with some of our veterans that are in our program. We also have a fair amount of our program graduates that have gone on to local community colleges and then have run their veteran program as well. Some other pictures of some of our veterans. And here we have, wrapping up the program, the Brain Injury Association of New York State, a statewide nonprofit membership organization that advocates on behalf of individuals with brain injuries and their families. And I think from here I'm going to let Carla take the role. Carla, thank you again so much for giving me the opportunity to talk.
No, thank you for being here. A lot of great stuff was shared today. Just some quick reminders. Any questions that were not addressed, I encourage you to email to me. I will be happy to get them to Tom. Again, you will all receive my contact information in a follow-up email from GoToWebinar. Please continue to visit our website for more information about our upcoming events and webinars. And I will be putting up the recording of today's presentation as well as the slides. You can expect to see those up on our website at some point next week, probably before, obviously, midweek. I'm hoping to get them up Monday or Tuesday. We will now start the question and answer session. We have about 15 minutes, so I will start actually taking questions now, and we already have some coming in. The first question I have here, and I have two that are somewhat related. The first one, Tom, is on the admission criteria, it was stated that PTSD or TBI related to military activity. What about an individual who had an undiagnosed TBI, say got into a motor vehicle accident or a fight which resulted in a diagnosed brain injury? Do you have access to military records to determine if there may have been an undiagnosed brain injury? I guess what's the process for those, or is there a process in place?
Sure. So we do have access to military records with the consent of that veteran specifically. So we can kind of step in and really help them, get their records to them that they may not have been able to retrieve. But like we said, like I said and mentioned prior, we see a lot of the undiagnosed injuries really not receive the attention that they needed to at the time. But we absolutely can help them and continually support them as well.
Excellent. This other question, it was also kind of related. It says, I believe it's a similar thing, part of your admission criteria is TBI military related. It says that, can you please explain further, since 80% of TBIs recorded for the DoD to date are non-deployment related. They are mostly in private-driven vehicles, falls, military training exercises, recreational activities, etc. And I think you kind of talked about this a little already.
Sure. So if it's I think discussing more on that, the TBI can be if it's a non-military related TBI, if it's a non-trauma related, we can still work with that and we can help the veteran transition. Typically the PTSD we're looking to be correlated to military service. However, the TBI, we can work with that veteran specifically on some of their goals. We have had veterans in the past that have come into our program after being in a vehicle accident in their own POV or losing control of their motorcycle and having a traumatic brain injury from that, and then we've worked with them on some of their PTSD issues from the military as well. So I might not have put in that directed that clear enough, but the TBI can be related to some other incidents as well.
Okay, thank you. I have a few more questions coming in here. Are returning reservists serviced, and if not, why not?
We absolutely help all veterans, including reservists. We actually see that a lot of those veterans are coming back, and their transitionary process is very quick. They return directly from military service and are expected to go right back to work almost immediately. So we see those veterans coming into our program almost as often as the active duty members are.
Excellent. Now, I know that I think you talked about a lot of great stuff, and someone else in our audience would like to know, are there other warrior salute programs in other states, or are there similar programs in other states? What is your experience with this, or do you know of anything similar?
Sure. So my program role is actually adjusted in the past couple months, and I'm transitioning from a program manager to director of strategic placement and leadership, and we're looking to expand our program. However, part of my role is to travel and ensure that there aren't other agencies out there that are like ours. We see a lot of huge programs out there with great outreach and also some incredible marketing skills, like the Wounded Warrior program and some of the other agencies out there. But what we don't see is that individualized approach. We see them bringing clients in and maybe only helping them with one aspect, a vocational placement. Well, we can help you with your job, or we can look at your resume, or possibly we can get you linked up with a therapist. But I, in all of my travels, haven't been able to find a program that mimics ours. We have seen agencies out there like the Veteran Outreach Center that helps work with these veterans and get them to agencies like ours. But we're the only one in the nation. We do expect on expanding over time, but like I mentioned, it costs about $20,000 to $25,000 per veteran to go through our program, and it is about a $2 to $3 million startup fee. So we are privately funded. When we do receive government funding or another maybe privatized grant or something along those lines, we can look at further expanding and helping additional veterans.
Excellent. That brings me to one of my next questions. Well, two actually. I have one question. An individual would like to know if you do have any kind of partnership with Wounded Warrior Project.
I'm sorry, I was muted there.
Oh, it's
We
okay.
have worked with the Wounded Warrior Project in the past, and they do supply us with some referrals. We have applied for some grants through them as well. However, we're not, I don't know, maybe grant material through them, but we do work with them in the referral base and try to bring as many veterans into our program that are ready for our program. So yes, we do. We don't receive any funding from them, though.
Okay, and the second question I had for you is I am getting a lot of questions about funding. How is this project funding? I know you said it's privately funded, and I don't want you to put you on the spot. So if this is a question that you would like me to have people email you personally, I can. But I do have some questions, if you're funded by the TBI waiver or about funding in general. Again, don't want to put you on the spot, Tom, but if there's anything you could share.
Sure. So we are not funded through the TBI waiver program. We do work with them. We have had veterans in the past. What we find, however, is a lot of our veterans aren't eligible for that because of income stipulations or pieces along those lines. Like I mentioned, we have had veterans in the past that are able to utilize that. Our program and our funding is done through private donations and fundraisers. We do have a fundraising team. We do some corporate sponsorships as well. So we have a couple major corporate sponsors, but most of it's done via golf tournaments and motorcycle runs and bowling tournaments and things along those lines. We heavily rely on our local community to step forward and help our program, help these veterans transition. We did just receive a $100,000 grant through New York State through line item, which I don't think it's fully gone through yet, but that's going to help us pay for some of the privatized care that the veterans have to have. We see a lot of veterans coming into our program with other than honorable discharges due to their TBI or PTSD, and then we help them transition and change their discharge status. But while their discharge status is OTH or dishonorable, they're not able to receive VA services. So for a long time, we're paying for private practitioners to come and work with the veterans, whether it's a psychiatrist or a general physician, and that is very expensive. So we did just receive a grant for that.
Thank you, Tom. I have an interesting question, and I'm not sure if you have an answer to this, and if not, it's something that I would actually like to research myself. This individual would like to know if you have any knowledge of how much higher the TBI suicide rate is from non-TBI suicide rate. And it looks like, I guess, of the population of soldiers you're referring to in the last 5 years or 50 years, whatever that time period is. Do you have any idea?
I don't, and I think that's going to be a very hard question to answer because so many of these veterans go undiagnosed, and the veterans that do show up to the VA, there's a very, very small percentage of the veteran population that actually does follow through, register with the VA. And the issue that we're having is the VA has a huge roadblock in communicating with DOD. Most people think that their records are one, and when you get out of the service, the VA automatically absorbs your records, and that's absolutely false. The VA actually doesn't have access until you push them to get access to your private medical records. So I don't have a specific answer to that, and I don't know if you're going to be able to...
I think it's a difficult one. Yeah, I don't know if it's possible to even tease that information out.
Great question.
But it's a great question. We have about 4 minutes. I only see one question here, so this is the last 4 minutes to get any questions in that you have. But the question I have up right now from one of our attendees is, how many veterans do you serve each year? Does Warrior Salute serve each year?
So through our Track 1 and Track 2 program, we typically help anywhere between, I think a couple years ago we only helped about 35 of them, and we can assist 50 to 60 on the higher side of things. But again, that's one of those questions that's very challenging because through our graduate support program we continually help veterans, and also through our outreach, and when veterans come into our program they're not necessarily ready for our program yet. We do help them transition and re-refer them to another program, but usually we're right around the 30 to 45 mark. We've helped more than that. We've also helped less than that since our program inception.
Wonderful. Well, I don't have any more questions at this time. If for whatever reason someone couldn't get their question in, again, we would be happy to answer it. Just send it to me in an email. I'll get it to Tom, and I'm sure he'll be happy to help. That does conclude our webinar presentation for today. I just want to thank you again, Tom. It was very informative hearing about Warrior Salute. And I want to thank you all again for participating. I hope everyone has a wonderful day. Enjoy your weekend.